Okay. Anyone? Okay, I can see someone calling in from Salford, so that's good to know. Okay, so yeah, we'll get into this. Okay, good morning. Someone is calling from South London. Okay, thank you for joining in today. So today our guest speaker is Miss Stacey Bryan. She's a consultant gynecologist and gynecological cancer surgeon. She has extensive research in cancer, gynecological cancer, and other female conditions. And she will be talking about our topic. It's called Together We Rise, Raise Awareness for Fibroids. And we're aware that fibroids affect the female reproductive organ, and a lot of African and Caribbean women have this condition. So it's very important that we can get a lot of information and specialist lecture and information about this condition. So please share your questions in the chat. Anything that pops up in your head, we are here to discuss it. We also have Anita, who is someone that has had lived experience with fibroids, and she's going to be giving us some insight into the kind of things that she experienced. So I'll hand over to Miss Stacey Bryan now to take over from here. Thank you so much.
Thank you, Dr. Sarah. Thank you and welcome everyone. Thanks for coming on a Saturday morning to tune in. I hope everyone can see the slides. Please raise a hand or put something in the chat if you can't, if there are any issues. Thank you, CAHN, for inviting me. I am Stacey Bryan. As you've heard, I'm a consultant gynecologist and women's cancer surgeon, which is what gynaecology stands for. And I'm also the chair of the British Caribbean Doctors and Dentists Association, largely an association that increases the representation of those of Caribbean heritage in medicine and dentistry. But we do a lot of work in terms of health promotion, workshops, etc., to try and educate our communities and advocate for our community as well. So I've just got some details there if you did want to contact me regarding the work that I do. So before I start, I'm hoping this plays. It looks like it will. I want to show you just a very quick short film trailer called Mango by Joan Eola. I hope I've said that correctly. At the moment, it's doing the international film festival circuit. So it's not released just yet. It's sort of mainstream. But it really highlights a woman's experience on fibroids. So it's a very short clip. And again, I hope you can hear the sound.
Well, this big one.
Wait, what are you doing?
It's very common for women like you.
Don't worry, you'll be fine.
This isn't sustainable.
That's really just a very, very short clip just to see. I know there will be a lived experience shortly by Anita. So again, we will hear more from people who are living with fibroids. So what do I want to talk about in the next sort of 20-25 minutes? Well, what are fibroids? The different types of fibroids that there are, how it affects fertility, likewise how it affects pregnancy and also delivery, and what can be done. And by the end of the session, hopefully we can inform you, we can empower you and answer any questions that you may have. So to start with, what are fibroids? They are largely non-cancerous growths of the muscle layer of the womb. And I say largely, and of course, being a cancer surgeon, I have to put in the caveat that very minimal, a small amount, less than 1%, can go on to become cancerous. But for the majority of the time, they are non-cancerous growths of the muscle layer of the womb. Just got an image of the womb here. So you have the ovaries with the fallopian tubes, which connect into the womb, the cervix, which is the neck of the womb, and the vagina. The womb or womb uterus, I often use the two names interchangeably, is made of the outer layer, the inner muscle layer, and then the actual cavity itself, which is made of the endometrium, which is the lining where you bleed from each month, essentially. So 1 in 3 of the general population will develop fibroids. The age group tends to be at between 30 to 50, but actually, you've seen this stat before in all of the promotions from CAHN, 80% of Black women will develop fibroids by the age of 50 years, and actually 60% by age 35, so quite young in those childbearing fertility kind of ages, and it does have an effect, which I'll go into. Unfortunately, they are often larger, and they do cause more symptoms and more severe symptoms and also complications. What that also means, unfortunately, that the treatment options are narrower if they're being diagnosed later. There's not much research that is done into fibroids, and I'll touch on a few things throughout this talk. And certainly we know that there is a need for either increased awareness, detecting this earlier so that we're not suffering when the symptoms are severe and when treatment options are limited. There is a link to estrogen because we know that after the menopause, so once you stop having periods, when the ovaries start to decline, when your estrogen levels decline, fibroids do tend to shrink. So why are they common, particularly in the Black community? Again, there's really a paucity in terms of research. A lot of the research has been done in the States. So some we extrapolate over to here. But of course, different environments means that there are different, we can't necessarily take everything over from the States, but it gives us a bit of an idea. But certainly more research needs to be done. So the exact cause is unknown, but it could be a mix between genetics. You may find that a lot of people who have fibroids running in the family, they may end up having fibroids. And it could be because there are certain genes that have been identified which affect how you metabolize hormones, for example, how your cells grow, involved in the connective tissue, the muscle growth, which may mean that you're more prone to fibroids, which grow quite large. A higher lifetime exposure to estrogen. So that may be just a natural exposure to estrogen, i.e. starting your periods earlier and getting into menopause at a later age. So the average age of menopause in the UK is about 51. It can be slightly later for Black individuals as well. So that long-term exposure to estrogen, but of course, taking hormone replacement tablets or pill, etc., can also increase that exposure. A high body fat, distribution or high BMI. So again, it's to do with the way in which estrogen is metabolized or essentially made in fat cells. So the higher the body fat distribution, the higher the levels of estrogen. High red meat and low vegetables intake. Again, there's some studies that have looked into that. It's not necessarily strong evidence, but the evidence is suggestive there. Vitamin D deficiency is quite a big one. Now, everyone in the UK, particularly Black people within the UK, should be taking a vitamin D supplementation. You can get that over the counter in any vitamin store. So we should all be taking that. But there are studies that show that lack of vitamin D or vitamin D deficiency does make you more prone to fibroids or certainly to fibroids growing. So vitamin D is a big one. And then some studies have shown environmental factors such as hair relaxers, endocrine disruptors, which are under investigation, which may be absorbed through the scalp and affect hormone and metabolism. And then that can increase your chance of growth of any fibroids. And of course, the big one is stress and systemic health inequalities too. We mustn't ignore that. So moving on to the types of fibroids now. So by far the most common is what we call intramural. So these are fibroids that are sitting solely within the muscular layer of the womb, of the uterus. The next will be what we call subserosal. So it starts in the muscle, and as you can see here, it pokes outwards onto the outside of the womb. And then you have the submucosal. So these are the ones, again, it starts from the muscle, but it pokes into the cavity of the womb. Now, depending on the location, the size of the fibroid would determine how we would necessarily treat it. So a fibroid on the outside, for example, you would potentially recommend surgery to remove this fibroid. You can make an incision over here and shell the fibroid out. For fibroids that are inside the cavity or pressing into the cavity, we would recommend a hysteroscopy, which is a camera test, which has a look inside the cavity, inside the lining of the womb, and you can remove the fibroid that way. I'll talk a little bit later about intramural fibroids and how we may treat those. So what may be some of the symptoms? So some are found what we call incidentally. So there are no symptoms whatsoever, but you've gone along for a scan for a different reason. And someone says, oh, did you know you've got fibroids? In that situation where there are no symptoms, it's found incidentally, you didn't even know you had it, you don't necessarily need for it to be treated. However, some of the other symptoms to be aware of are heavy and prolonged periods. So your periods shouldn't necessarily, everyone's cycle is different, firstly to say. Everyone bleeds a different amount. But if you've got a change in your cycle, their periods are becoming more prolonged, you're having spotting before and after, you're having to wear extra, pads, tampons, etc., combination of the both, then we need to think about, is there a fibroid that's causing these symptoms? Pelvic pressure or bloating, so particularly when the fibroids are quite large, it causes a lot of pressure on the pelvis, pressure on the bladder, for example, and it can give this bloating, obviously with the fibroid growing quite big, a bloating sensation. Pain during sex, particularly if the fibroid is quite low down. Frequent urination or constipation. So the womb is about fist size. In front of the womb is the bladder. So if you've got a fibroid growing out, it can press on the bladder. So that means that you need to go to toilet more frequently. Or if there's a fibroid on the back, it can press on the bowel that's behind it. It means that the evacuation of your stool is not so free as well. So it leads to constipation. Backache, again, this is about the pressure and the weight of any large fibroids on the pelvis itself, which can cause you backache. And fertility issues or pregnancy complications, which I will go into in the next few slides. So how do fibroids affect fertility? So if we look at all women who are trying to become pregnant, they've been trying for a year or two, and they're not achieving pregnancy, when we do the investigations, about 5 to 10% will have fibroids. The majority are due to other causes such as polycystic ovaries, endometriosis, these sorts of things, male factor, fertility. The effect it has on fertility does depend on where it is, the size, and it tends to be those more than 4 centimeters, and the number of fibroids that you have. With the subserosal, so the one on the outside having the least effect, then followed by intramural, and the submucosal being the one that has the most effect because it's where implantation will occur. So just to show all of this in that diagram here, how can it affect fertility? So usually you have the egg is released from the ovary, captured by the ends of the fallopian tube, travels down into the cavity, sperm comes and meets it here, and implantation occurs. You can imagine if there's a fibroid right at the edge of the fallopian tube, it can actually physically block sperm and egg meeting. It can also prevent the fertilized egg from actually attaching. So for example, something like here, it can prevent it from actually attaching safely to the lining of the womb. It can change the shape of the cervix if there's a fibroid that's near the cervix or close to the cervix. And in fact, with cervical fibroids, the recommendation may be for a cesarean section for women who do fall pregnant because the cervix doesn't dilate to allow passage of the baby during labor. There is an increased risk of miscarriage, and again, more to do with that implantation not occurring. Distorting the shape of the cavity, again, you can see here where the submucosal fibroid is pushing from the muscle into the cavity, so it distorts the shape, which should be a nice sort of Y-shaped. Increases the risk of preterm birth as well. And particularly with the submucosal and the intramural fibroid, what happens is the uterus contracts. The uterus is a muscle altogether, so it will contract because there's something in there that essentially shouldn't be there. And this then reduces the blood supply to the womb, which then can interfere with implantation. It causes inflammation, etc. It basically causes a hostile environment, which means that pregnancy can't necessarily implant and continue in the normal ways that it should do. And I touched on it already that there are some genes and some biochemical factors which may be reduced or altered in the presence of some types of fibroids, such as the intramural fibroid. So what's the effect on pregnancy and childbirth? So someone has managed to get pregnant. What does it do to pregnancy and childbirth? So fibroids occur in about 10 to 12% of all pregnancies. It can cause the placenta to implant in a different way. So usually it should be quite high. It often becomes a low-lying placenta. Again, another reason why one would recommend a cesarean section. Already mentioned about preterm birth, so delivering earlier than your 40 weeks or your 37 weeks. Because the fibroid, if we go back to this, you could imagine if a baby is in that cavity as the uterus grows, sometimes the fibroid grows with it as well, and the baby can't quite get into the position that it should do, i.e. head down, and often is breech or even lying longitudinal, or what we call transverse. And that, again, is another reason, or they could switch between those different positions. And again, that's another reason why a cesarean section may be recommended. Already mentioned that as the pregnancy grows, as the uterus grows, as the fibroid grows, that growing, that stretching can cause pain during pregnancy, but also the fibroid can almost outgrow the blood supply, and it undergoes what we call degeneration, and that process in itself can be quite painful too. So degeneration can happen during pregnancy, does mean admission to hospital, use of morphine, these sorts of things. So it is a complication that we do see during pregnancy as well. Already mentioned the need for cesarean section, and also something called postpartum hemorrhage, which is heavy bleeding after delivery. Once the baby's delivered, once the placenta's delivered, the uterus naturally contracts itself down and helps to control bleeding. Particularly in the face of a large fibroid or multiple fibroids, the uterus can't contract in the way that it should do, and therefore there is a higher risk of having bleeding, needing a blood transfusion, sometimes in very severe cases, even needing a hysterectomy. So these are things to consider. But I must say that many women with fibroids do conceive, and they do have healthy pregnancies. So it's not all completely a loss. So how are fibroids found? So I mentioned that some people may go for a scan for something else completely different, and a fibroid is found in that way. Or if you go with symptoms, a doctor will do an internal examination, a pelvic examination, and perform an ultrasound scan. This may be on the tummy if it's quite a large fibroid, but most of the time it will be an internal scan. And if a fibroid is found, they may refer you on for an MRI, particularly if they're thinking about surgery and wanting to know where exactly the fibroid is to be able to plan the surgery. Other techniques such as saline sonography or a hysteroscopy, again, these are more looking at fibroids that are inside the womb to identify their locations. So what can be done? Again, already said that not all fibroids require treatment. It does depend on the symptoms, the size and the location, and whether or not someone is premenopausal, postmenopausal, wishing to have children or not. And the treatment goals really should be to control the bleeding, reduce the size, because it's the size that causes the pressure symptoms, the urinary frequency, the constipation, etc. And where possible, preserve, or where desired, preserve the uterus and fertility. So what are sort of some of the treatments? So going from sort of non-surgical first, you may be offered what we call tranexamic acid and mefenamic acid. Now, these are non-hormonal, and they're usually taken during the time of the bleeding, and that's just to help lighten the bleeding, and also the pain, help with the pain during the cycle. So that's taken regularly with each period, essentially. The other hormonal option is the oral contraceptive pill. That could be the combined pill, it could be progesterone-only pill. And as I mentioned before, fibroids respond or react to estrogen. Throughout your normal cycle, throughout a woman's normal cycle, estrogen levels can go up and down. And it's these kind of peaks of this up and down and changes in the hormone levels, which may mean that the fibroids, respond and tend to grow. What the pill does is just shuts all of that down, calms it down, and then it gives you just one baseline steady level, low level of estrogen and progesterone together, which means that there's just like a constant lower level and helps to kind of settle or certainly not promote growth of any fibroid. So that's why it may be recommended if someone has a fibroid to go onto the pill. With that, it also helps to lighten your periods as well, lighten the bleeding. Remember, the goal being to help to lighten the bleeding and be able to control manage the bleeding from day to day. Other options are what we call the Mirena coil. So this is this T-shaped coil that is inserted into the cavity of the womb itself. It has progesterone in there, and the idea is that that thins the lining of the womb, thins the endometrium, and again, lightens the bleeding. So you will still get some bleeding, some periods, but it should be much lighter. Another one is an injection called Prostap, or what we call GnRH analogues, and this basically puts you into temporary menopause. So again, shutting off all of the hormones, and the idea trying to shrink down the fibroids. It's usually used for a temporary measure, so if you're waiting for surgery, for example, or if you just want to trial it to see if it shrinks enough to settle some of the symptoms that you may be having. And we use it on like a 6 to 9 month basis. As I said, it puts you into menopause, so all of the symptoms of the menopause come with it as side effects, so hot flushes, poor concentration, night sweats, vaginal dryness, hair thinning, but also bone thinning as well, which is why we can't use it on a longer term basis. We need something a bit more definitive after these injections. There was another medication called ulipristal, which used to be used, but unfortunately it caused issues with the liver and now has sort of been more restricted or selected use now. It's not widespread. There's a newer medication called Relugolox, which says there are other companies that produce something very similar, but it acts like the injection, except that it's an oral tablet. And it also has hormones, so estrogen and progesterone, to counteract the menopausal symptoms that you may experience. And it seems to be quite promising for symptom relief, more so for the bleeding symptom, some level of shrinkage of the fibroid as well, but not as much compared to other options that are available. So you may have heard of it, is also named Ryco, and has also been marketed for as a treatment for endometriosis as well. So that's another medication that's new out there. In terms of the surgical options, again, if we're looking at fibroids that are inside the cavity, we would offer a hysteroscopy, so a camera going inside the womb. In the center here is the actual fibroid, and we would remove that fibroid essentially. It can be done as a day case procedure, going home the same day. It's found to improve pregnancy rate, so the chances of pregnancy after this removal of fibroid is about 50 to 60%. Some people need repeated hysteroscopies and removal of the fibroid because it's a bit bigger than expected. And when you remove a piece of the fibroid, it often pushes back into the cavity and you need some more treatments to remove it in totality. But the repeated treatments can cause some scarring in about 10% of cases. Womb recovery said to be a month, so that means that if you wanted to try for a pregnancy afterwards, we would say give it a month, so wait for a period, and then try for a pregnancy afterwards. Other surgical options, myomectomy, which is removal of the actual fibroid itself. So this is on the outside, or it's in the muscle of the womb, and it can be a traditional open cut, or it could be by keyhole surgery. She usually suggested or reserved for fibroids that are more than 4 centimeters and with symptoms. So if there is a fibroid that's more than 4 centimeters, but you're not necessarily having symptoms, again, you don't necessarily need to be treated, could be monitored, for example, or if there are symptoms, then, advising to see a doctor about getting it removed. There is a risk that in the process of removing the fibroid that we enter the actual cavity. And in those situations, we advise that a patient should deliver by cesarean section when they do fall pregnant. The womb recovery here is said to be about 3 months, just to allow everything to heal. There is a small risk of a hysterectomy, so needing removal of the uterus, particularly in the bigger fibroids, as it can cause a lot of bleeding. So fibroids really do draw in a lot of blood to them, and removal of the fibroid in that process can lead to quite heavy bleeding, which in some cases may lead to needing a hysterectomy. And then this is just an image of some fibroids, what they look like once it's shelled out. Some alternative options very quickly to run through, one called uterine artery embolization. So this is basically where they block the blood supply to the uterus and that causes shrinkage, to the fibroids, and that causes shrinkage of the fibroids. Endometrial ablation, this is where you burn away the lining of the womb. So again, helps with not necessarily removing the fibroid itself, but it helps with the bleeding symptoms. But we wouldn't recommend this if people are wanting to try for pregnancy. And of course, hysterectomy is the more definitive option. There is a newer technology called Sonata. So this uses radiofrequency ablation, essentially. It can be performed under local anesthesia as a day case for those who may be wanting to avoid surgery. But in terms of pregnancies, there have been some pregnancies after it, but they're suggesting, there needs to be, again, more research into the effects after having Sonata treatment. But essentially, a device is passed into the fibroid or next to the fibroids some needles are injected into the fibroid, and there's like a pulse of energy which helps to break the fibroid down. And then you'll see over the course of a few weeks that the bits of fibroid tissue are expelled basically through the cervix and the vagina. Some people need repeated treatments, particularly if there is more than one fibroid, and essentially works better on smaller fibroids than bigger fibroids. I think they go up to 8 centimeters, I believe. Touching on lifestyle diet, already mentioned vitamin D should be part of your preconception medication anyway. And again, we've seen that lack of vitamin D has shown an increase in fibroid production and growth. For a lot of women who have fibroids that are bleeding heavily, they may be anemic. So thinking about iron supplementation or having iron within a balanced diet. Exercise and stress reduction seems to play a role. Herbal and natural remedies, there is some mixed evidence, but always just discuss with the doctor, because some of the herbal and natural remedies may kind of cross-react with medications that that doctors may suggest to you for treatment of the fibroid. So just being open and just saying so that it can be tailored. So I think this comes close to the last slide. So advocacy and assessing care. Please push for referral if the symptoms are affecting your life. I know a lot of people have said that they've been suffering for months, years even, not taken seriously. If you go to one GP, it's within your right to ask for another GP. It's in your right to ask for referral to a gynaecologist. And know that second opinions are okay. It's absolutely fine. It's not going to affect your care by asking for a second opinion. Actually really encourage second opinions if you're not happy with the first discussion that you've had. Ask for a pelvic ultrasound scan if you are concerned, if you're having symptoms of pain, heavy periods, bleeding between periods, prolonged period, these sorts of things. Cultural safety matters. You do deserve respectful and informed care. So really encourage people to sort of reach out and really push if you're having any symptoms that you're worried about. So the key takeaways: fibroids are common, especially in Black women. Many options do exist, so you don't have to suffer in silence. I would say that the options are dependent on how big the fibroids are, how many you have, and what the locations are. Advocate for your health and don't ignore any symptoms, and please do share anything that you've learnt with others. Lastly, these are just some websites, some links that you can sort of note down if you wanted to learn a bit more, particularly about Sonata treatment. Sonata treatment is only done in a few centres across the UK. It's done more in the private sector, but there are only 1 or 2. I think it's Royal Free, possibly UCH in London, and somewhere in Manchester, I believe, where it may be available on the NHS, but it's best to research it and have a look. And the scans are, I had the privilege actually of being invited to CAHN's APPG on Black Health a couple of weeks ago, I think it was last month or so, at their House of Lords, and we were discussing everything fibroids. CAHN have very brilliantly done a rapid scoping review and basically highlighted the need for more research, and that's been taken up to Parliament. So these scans are the scoping review and a little PDF about, the information that they found out. And on the same level, they are asking for a call for evidence, reproductive equity and fibroids. This QR code is a scan to participate, please, in the survey that they're running, because they need to get the evidence together to be able to bring it to Parliament so that we can start to make changes. So yeah, I'm sure it will be available on their website as well if you don't catch it here in this presentation. And then lastly, just to say, I do also work privately. If there are any questions, anyone wants to see me for a consultation, these are my details. If there are any general questions that you want to ask, if you contact via CAHN, and if there are anything sort of specific, but of course we'll have a Q&A after this. I can't give any definite specific details regarding any one specific what should I say, it's a situation, but very happy to answer anything sort of generally about treatment of fibroids. And thank you very much.
Thank you so much, Ms. Stacey. Very brilliantly done. Extensive and concise information on fibroids. I'm aware most people didn't join in earlier on, but Ms. Stacey spoke about fibroids and how it's really common in Black and or African and Caribbean women, and also the symptoms that a lot of women experience. And she highlighted that estrogen, it's mainly the driving factor for the fibroid size and even the severity of the symptoms. And one important point that I wasn't really aware of was vitamin D. Having low vitamin D as well increases fibroid size. She talked about the symptoms of heavy periods or pain and the effect on fertility. So that also was very important. Stacey explained how fibroids can lead to pregnancy loss or difficulty getting pregnant, or complications, even having cesarean sections, which is more likely for people that have fibroids. And also, she pointed out that many women still go on to have normal pregnancies despite having fibroids. She also spoke about the different types of ways to discover or diagnose fibroids, such as scans, camera scans, and sometimes it could be incidental because many women still don't have symptoms as well, and they find it out when they're going for their regular checkup, for example. She spoke about very well about the different treatment options. There's a lot of treatments that are available for women, hormonal treatments or non-hormonal treatments, pain control, and she talked about surgeries and also injections, and all of these are hormones that would help decrease the size of the fibroids and treat them. And she spoke about the side effects of these treatment options as well. So thank you so much, Ms. Stacey. There's some chats. You've already answered some of the questions that were in the chat already. Someone talking about the Sonata, which is a new treatment that is available in some NHS. Let's look at other questions. Someone is saying from Anne on YouTube, please tell us about the 1% that can lead to cancer and if there is a link with HPV. That's a very good question.
Yeah, so very briefly, I scooted across it because it is very, very rare, but obviously I see it as a cancer surgeon. So what I would advise is if you've known to have fibroids and they're rapidly increasing in growth, then that's where you need to go and speak to your doctor who would lead you to get a referral to a gynaecologist. And usually we will request an MRI, and that can let us know whether or not we should be worried about what we call sarcoma, which is what a fibroid can grow into. But it's extremely rare. I don't want anyone to kind of labor on that point or be worried about it. It's just I mention it being a cancer surgeon. Linked to HPV, no. HPV is linked more to cervical cancers, head and neck cancers, and also vulval and vaginal cancer. So there's no link to HPV here.
Thank you very much. Well said. Someone said, please do. Okay, so let's go on to another session of this health hour. We have Anita, who is a woman that has experienced fibroids herself, and she has willingly come to talk about this and share her experience with us. So that will be interesting for us to hear. Also, we have this competition alert. I have to bring it up to everyone. Please take part in the survey and take a screenshot and send it to the email address in the chat. The competition closes at 3 p.m. and good luck. You get some prizes if you engage. Thank you so much. So let's hand over to Anita for now. Thank you.
Hi, thank you so much for having me. Yeah, so for me,
Thank you, Anita. Okay.
Yeah, hi. Thank you.
Okay, so could you take us back to when you first started experiencing symptoms of fibroid, what they were, and when you knew something wasn't right, and then, yeah, really generally talk to us about how you dealt with this. Thank you.
Yeah, sure. So for me, it first started with heavy prolonged periods and extreme fatigue. So I was always tired, and I just felt I started like, feeling like a lot of cravings for non-food items. So like ice, I would like eat ice and clay as well. So, those earthy smells. And I just thought, something's not right here. And I felt really embarrassed as well, to speak to my mom about it. So I would buy like a lot of clay and then I would hide it and just eat that. But then I would find I'm really, really constipated. And then, so yeah, that's when things just kicked off. And most importantly, the heavy bleeding. So I just thought I needed to see my GP about this. So yeah, that's how it first started.
Okay, thank you so much. And so I can imagine how difficult that must have been for you. And it was very challenging. Do you think,
Yeah.
did you go to any healthcare professional to seek some advice at some
Yeah, so
point?
I went to my GP and then I said, I've got these cramps. They were really, really severe and I would get bloated quite a lot. But my doctor at the time was very dismissive, wouldn't really like take me seriously. And I kept going back and back. And then again, I couldn't really open up about like this habit that I developed of like eating clay because I was just too scared to like say to the GP like I'm eating clay. And but I think if I'd mentioned that, maybe they would have taken me more seriously as well, because they could have picked up like I'm craving something that's not a food item. But yeah, again, it never taken seriously. And um it kept going back and forth, and I would go with like my tummy would really swell. I noticed like it started swelling up and very, very painful, heavy periods.
Wow, that sounds
Yeah.
very difficult. Thank you so much for sharing. A lot of women have these experiences and they don't know how to come about even talking with professionals about it. So thank you for bringing this up. And do they offer you treatment options or help with your decisions or about your care?
So interestingly, the first thing that after being diagnosed, this is after years of like being in pain, going back and forth and all of that. So it's only when I changed GP, when I went to uni, I had to register or sign up with a different GP. And then again, these symptoms just wouldn't go away. And then it kept getting worse. I kept like getting lightheaded at this point, very dizzy, and I got very irritable and, just I couldn't breathe properly as well, just out of breath and all of that. So then they ordered a scan initially, and ordered bloods to be, for me to have bloods taken. And then she said that I was really, really anemic at this point, and because I couldn't walk, I was literally crawling with pain and everything. And then so when they ordered the scan, they said I'm really, really anemic. So they put me on ferrous sulfate, which I'm still on at the moment, and said that they're gonna, do other tests as well to see what was going on with my stomach and why I was experienced, so much pain. And then they did a laparoscopy operation. So that was my first operation that I've had, is a laparoscopy to see what was going on. And then that's when they diagnosed the fibroids. So yeah, so since then I've been on different things, but as at the moment I'm due another procedure. This time it's removed. I had last 2 years ago now. I had a embolization, but that's not worked. I just went for my final review not too long ago, and it's not worked. So about a few weeks ago, I went for a pre-op because I'm having they're gonna try to like remove the fibroids this time. So, and then I'm on Prostap injections at the moment. So I have those every 3 months. So that's to stop sort of the heavy bleeding that I've been experiencing and to just sort of ease the symptoms. But then with that, I've like I get like menopausal sort of symptoms. So I'm on like different medication at the moment. So I get like, is it Gel, I think, for the symptoms with the, menopause. And so yeah, it's just different things, different options. But yeah, to begin with, no, they didn't offer me any sort of, a wide variety. It's only when I spoke to Dr. Faye, and then she referred me to one of um, a gynecologist that she knows, and it's only when this gynecologist said to me that no, you don't have to have a hysterectomy. There's so many different options out there. Why? And you're young, and you said you want kids, so why don't you try those different options? So when I went back to my gynecology, that's when I said, you've offered me this, but I've been told that there's different things that I can try first. So it's been a journey. So they've tried the embolization, that didn't work. So now they're going to try. So hysterectomy for me is a last sort of option, because I did want to try for more kids.
Absolutely. Thank you so much for touching on all these different points that even Ms. Stacey brought up, including the treatment options and um, expressing how the symptoms of anemia really affected you. So it's important that everyone is aware that even if you try one option, treatment option, there are other ways you can go about it.
Absolutely.
Yeah, and one size doesn't fit all. So thank you for bringing that up. And we have a lot of questions in the chat. But before we wrap up, let's wrap up with Anita. Would you have any advice for the women that are experiencing fibroids currently? And
Yes, I do actually.
how to deal with
I
it?
would advise women to trust their bodies. It's very important. You know your body, and you know when something's not right. So don't just like sit on it, and don't let them brush you off and not listen to you. Make sure that they do listen and follow up as well. Because at some point I got lost in the system. I don't know how. So it even prolonged the process, because then it meant my GP had to sort of re-refer and start the whole process again, which I feel could have sort of minimized my symptoms, and they could have helped sort of reduce or shrink the fibroids. But yeah, I got lost, and then yeah, started the whole process again. So don't be don't let anyone tell you, oh, no, you're fine, and things like that, which in my case happened to me as well. It's nothing, it's not, so my GP would feel my belly and would say, oh no, there's nothing wrong, you're fine. And then I would go home, but then I would suffer these symptoms, and then seek medical help, push for tests and scans as well, and know that you're not alone in this. So I call it my fibroid journey, because it's been a journey, honestly. And I've delivered my baby, my son. He's now 5, but he was born extremely premature. So he was born at 26 weeks. So things like that, when I think if I'd sort of got treatment earlier, it could have helped me a lot. So, and the last thing that I'd like to say as well is to advocate for yourself and find, communities like this one, and platforms like this, the Health Hour, which is very, very beneficial, where women can share stories and learn from each other. And I'm sure by me sharing my story, 1 or 2 people can say, oh, well, I can relate to this and I can relate to that, or there's these options that I have. So yeah, that's what I would like to advise women.
Absolutely. Thank you so much. Very, very helpful and useful for everyone. So we can go on to the question and answer session. In the chat, we have Priscilla. She said, hello, I'm 26, pregnant, and I have a 5 centimeter uterine fibroid, which went through degeneration when I was about 16 weeks pregnant. Can I have a normal vaginal birth?
Yes, so thanks, Priscilla, for your question. As I mentioned in the presentation, it depends where the fibroid is. So if the fibroid's next to the cervical canal, so the neck of the uterus, the opening to the uterus, at the time that you're ready to deliver, so 26 weeks, there's still a little bit of time to go. As the pregnancy grows, the uterus grows, you may find that the fibroid is moving out of the way. But if it's quite a low-lying fibroid, and at, by 36, 37 weeks, it's still blocking the cervix, then the recommendation would be cesarean. If it's completely moved out of the way, then there should be no reason why you can't have a normal vaginal delivery. That answers it.
Yeah, thank you. Thank you, Ms. Stacey. And we have another question from, I believe, online. It says, how do fibroids affect intimacy and sex, and how do I talk to my partner about it? They also have support groups. Yeah.
That's a very good question. As I said, sometimes fibroids that are low lying, it can cause pain during intercourse, and of course that puts you completely off having intercourse. And then, you know, if you're trying for pregnancy, that's another layer as well. It can be quite difficult. I would say, firstly, obviously seeking the help to get the treatment to help with your symptoms firstly. In terms of talking to, how do you talk to your partner? I don't know if Anita may have some tips regarding that, but again, I know it can be difficult, but inviting them to educational sessions like this, just to sitting in this, I think it's very important for men to sit in on these sessions, so they know what's going on. They know what women are going through as well, so they understand it. So perhaps inviting them to these types of sessions, and also seeing, you know, support groups and things. That's what I would say, but I don't know if Anita would add anything there.
Sorry, I missed that question. Sorry, could you just repeat that, please?
The question is, how do you talk to your partner about symptoms of fibroids?
Right. That's a very, very good question, because for me, obviously I had a very sort of short time to, you know, I could tell you a lot more about this topic because it's, you know, it's very close to my heart. But yeah, I've lost a relationship because of it. So I don't know if you've heard about flooding for, you know, those people that are experiencing, you know, fibroids and that. So it's just where you know, you bleed quite heavily. And, you know, for me, I would spoil even my sheets when I'm sleeping and things like that. So I think, and I was very embarrassed, but I think what's important is, you know, to first of all, have an understanding partner and talk about it as well, not to be ashamed. I used to hide it a lot, and I think it made it worse. I wasn't very open. I felt very, very embarrassed. But now, you know, I'm not. You know, it's something that it's a condition that, you know, affects me. So it's nothing to be embarrassed about. If anything, people should be more understanding. And I think, as you said, having sessions like these is very, very helpful so that people can understand what women go through, and then they'll be able to get like that support from their partners, and just encouraging your partners maybe to join in these sessions so that they can learn, because sometimes educating people is very, very important.
Thank you. Thank you so much. And in the same question, they talked about support groups and services. I believe that's also, you also mentioned it. And if we can have some specific examples or options, we can put that in the chat. Another question was, what should I ask my GP or gynecologist during a fibroid consultation? And I believe, Anita, you spoke about this, and Ms. Stacey also mentioned about how you can also get second opinion from different healthcare professionals. It also leads on to the next question or comment by Barbara, who said, it happened to me as well. My doctor said, oh, as far as you're not in pain, there's nothing to worry about. So at a point, I had to lie, I was in pain, and that's when they made a referral for MRI. So any of Anita or Miss Stacey, anyone has any comment on how to talk to your GP or gynecologist about fibroids?
Yeah, I mean, as I said, I would just say that again, the main aim of treating fibroids is to help with the heavy bleeding and any pressure symptoms, pain that you're having. So if you are having that and you're expressing that to your GP, then and they're not listening, ask for another GP. Another good thing to do is have a symptom diary as well. So when you come in and you say, well, this day, this, so the evidence is essentially there that, look, it is affecting my life in these ways. I may not be in pain, but I was bleeding. I had these many days off work because of bleeding. I couldn't get in, etc., etc. Then it's all down and written. And if you're not happy, as I said, you have the right to see a different GP and just seek that second opinion.
Yes, absolutely. Thank you so much. Someone said, I think, Rumbitizia, sorry if I didn't pronounce it well, I had to try. Hi, can a 2 centimeter fibroid inside the uterus cause very huge clots with continuous bleeding of about 21 days in a month? This is while on the mini pill. Okay.
So yes, it can, in short. So again, as I mentioned, if there's a fibroid inside the cavity, this one tends to be the one that causes exactly these symptoms: heavy bleeding, prolonged bleeding, almost like you're having 2 periods within a month. And that can be removed by hysteroscopy, so a camera inside the womb, removing that fibroid, and often that's enough to clear up those symptoms. What I didn't get a chance to add in the presentation is we often combine this with insertion of the Mirena as well. So we will discuss with you whether you'd like the Mirena coil inserted at the same time. Obviously, this is for people who are not wishing to go on to try for a pregnancy straight afterwards, because it does essentially what your mini pill, etc., would do. So we remove the fibroid, we put the coil in to then prevent or try to reduce any growth of any potential fibroids that's a little bit higher up or deeper in the muscle. So then that helps with the bleeding, the control, lightening your periods. And actually with the Mirena coil in particular, after about 9 to 12 months, about 80% of women have no bleeding at all. But the actual reason behind fitting the coil is to, again, as I said, trying to prevent that bigger growth of the fibroid again, and just keeping the cavity and the lining of the womb nice and thin and light, so it lightens your bleeding.
Yeah, can I just add as well onto that,
Yeah.
that if something's not working for you, so if it's for instance, I've tried different medications, and speak to your GP about it. If something's not working, so there's is it cetirizine? I'm not so sure about some of the medication, so I'll just say medications. And then it made me even bleed a lot more. So it made my symptoms even worse. So please, if something's not working, make sure you do have a conversation with your GP. They're there to help you, and they will help you. They're to find something that eventually either reduces the symptoms or works for you. Thank you.
Yeah, I just wanted to, I was going to touch on that as well, Anita. Thank you for sharing your story, because you beautifully presented exactly the sorts of things that I was describing in terms of the different types of treatment. You've gone through different ones. You said you had the uterine artery embolization that didn't quite work, so now you're on to the next step. So again, yes, you've been recommended one treatment, you've tried it, it hasn't worked. Please go back and say, it hasn't worked, let's look at something else. So I absolutely agree with that.
Yeah.
Thank you so much. There's the beauty in having different options for treatment. Someone said, what Teach said, what are the reasons for bloated tummy, heavy periods, and sometimes blood in pool, diarrhea, tiredness, and vomiting?
So the first thing, so it may be fibroids. They can give a lot of these symptoms. It may be something called endometriosis. So the first thing I would advise for you is to see the GP and get a referral for a scan. That's the first initial step, is what I would say, and get some blood tests and things done too. All right.
Okay. Touching on seeing another professional, Lydia asked, when you say see another GP for symptoms that our current GP isn't taking us seriously, we can only register with only one GP. Do you mean another doctor in the same GP practice?
Sorry, yeah, I should clarify. Yes, you can ask to see another doctor within that practice.
Yeah, and there are also specialist gynecological professionals that have private practice as well. It's really about research and then finding that support groups. I believe if anyone has any of the support groups or services that women share their stories and different options, I think that will be helpful to put in the chat. Someone asked, is tranexamic acid taking 5 days a month safe to take long-term, e.g. for many years?
So yes, in short, yes, it is, because it is just taking that 5 days rather than continuously. But what I would say is, if you're needing to take it for many years, maybe investigate whether there needs to be a more definitive or longer term treatment for the fibroids, if you're concerned about that.
Okay, I believe we're almost rounding up. So there's a question about, would you advise to stop contraceptive that causes irregular bleeding or prolonged bleeding? Could this later result in fibroids?
So this one, it depends, because some contraceptives it's known to cause irregular and prolonged bleeding. So it depends how long you've been on it for. It is known for, when you're starting it for the first few months even, that you get irregular and prolonged bleeding. So it's a bit difficult to kind of fully answer that, because some of them are just known side effects. Could this later result in fibroids? No, not necessarily. But as I said, there's a lot of work that needs to be done as to the causes of fibroids and things like that. So at the moment, there doesn't seem to be, but there is still some work and research that's needed.
Thank you so much. May I remind everyone about the competition of filling the survey and sending the screenshot. The competition closes at 5 p.m. today, so it'd be good to interact on that platform. If you have any further questions, the CAHN representative has put it in the chat to email, because I believe there's still a lot of burning questions that people may have. And this has been an absolutely great session, especially with Anita sharing her story and Ms. Stacey bringing up very specialist advice on this issue. So I can hand over to John, who is the CAHN representative, to round up at this point. Yeah?
Sorry, John, before you go, just one small little point before you wrap up.
Please.
Anita mentioned a symptom of eating chalk and clay, and these sorts of things. It's called pica. It's a sign of severe anemia. So exactly as she said, you think you're embarrassed to talk about it, is actually a medically recognized sign or symptom. Again, and that in her case could point towards anemia due to fibroids. So again, just saying that and letting your GP know. Thank you.
Yeah, thank you, Ms. Stacey, for clarifying this so everyone can be aware of the symptoms. And thank you, Michelle, as well, for sharing your own view and insights on this issue of fibroids and your treatment options. And so, John, thank you so much. Let's go.
Thank you very much. Thank you so much, Ms. Stacey, for this time. It's been amazing. It's been very informative. We want to thank you for taking out this time to bring out this information to us. It's quite a very sensitive topic, fibroids for the Black, women. It's quite very sensitive. So I want to thank you, Ms. Stacey, for bringing so much light, so much, knowledge, so much information. And I think we've learned so much from this session. It's been quite very brilliant. And I want to thank you for taking out our time. We're running with time. I want to thank you also, Anita, for sharing your story. It's very touching, and it's, I think a lot of women can share from what you've shared, and it's gonna help so many women out there. And thank you so much. Also, thank you to our amazing host for doing so much great work. Dr. Sarah, you've been so amazing today. Thank you so much. So quickly, we're out of time, so I'm just going to share my screen with us, if that is okay. Can we see my screen? Yes.
Yeah.
Can we hear me?
Yeah.
Oh, great.
Thank you. If you make it full screen as well, please. Thanks.
Pardon?
If you make it full screen as well, please. Thank you.
Okay.
Yeah, that's perfect. Thanks.
All right. Thank you. So I just want to share with us what we have in store as CAHN moving forward. We have, as we all know, it's still coming on next week. Our health hour, it's gonna be from 11 o'clock to 12 o'clock, the same time, same place. And I'm also inviting us all to be here for the same for health hour next week. So next week we're talking about creating healthier homes, how small changes can promote well-being. And we're having a guest speaker next week in the person of Dr. Folake Yusuf. So please do make it a date. And also please invite people, to come and also to be with us for next week's health hour. It will be very engaging and very insightful. Thank you. Okay. And next we have the Great Manchester Black History Month coming up in September 25th of September, and it's gonna be a very great time for us. I know it's happening in October, but we're starting much earlier to celebrate the Black history in Greater Manchester. So this is involving the entire Greater Manchester, and I want us to be informed about this. And also please do well to scan the QR code and to get more information about what we have in store for the Black History Month. Sorry, I'm struggling with a little bit with my screen. I think it's clear. Okay. So next we have the focus group, Bridging the Gap, Building Trust. It's in partnership with the University of Leicester. It's happening in Bristol Library from the 14th of July for age 18 to 44, and the 15th of July for age 45 to 70. So your voice. So we're bridging the gap and we're building trust. So your voice matters. So we want you all to please, if you could scan the code and get more details on this. Scan your code on research@cahn.org.uk and get more information, and also mail us if you have any question, please. And so we can also have we can revert to you back based on your questions on this. Sorry, I'm just being rushing, and that will be it. Yes, I want to thank you all for joining us today and for this week's health hour. Next week promises to be very exciting and very engaging also. And thank you again for everyone that has been on today for the health hour. We look forward to seeing you next week. And thank you and goodbye.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.